A device created by an Ontario surgeon to manage severe blood loss could help doctors and frontline workers save cardiac arrest patients. Incredible development. A Reboa is a balloon-like device. It's used to slow the loss of blood from severe internal injuries, but it also requires advanced expertise, as you can imagine. Dr. Adam Power, a vascular surgeon in London, Ontario, has created a smaller and easier-to-use version of Reboa, which could be used by paramedics. And Dr. Power, you can see, is joining us. You look like you're joining us from work this morning. Thanks for being with us.
I am. It's the afternoon in surgeon hours. Yep.
Well, kind of in my hours, too, actually.
Yes.
I understand that you've got the smaller version of the Reboa with us. Could you show it to us and explain to us how it works?
Yes, I have it right here. Probably the best way to understand it is that where we started from. If you have bleeding in the abdomen, normally you have to open up someone's chest and put a clamp on the aorta. What that does is it gives the blood flow to the heart and the brain and lets the bleeding in the abdomen be controlled. But that was a massive operation that we had to do. So we did this this technique called Reboa, or resuscitative endovascular balloon occlusion of the aorta, and we put it in from an artery in the groin, and we fed up a balloon up into the aorta, and instead of clamping it from the outside, we actually used a balloon from the inside. But we started out with devices that fit through this big sheath in the artery in the groin. And so when we put these in, we had to actually cut down and fix the artery.
Yeah.
And so we've shrunk it down to, it goes through this size. And this is our device that gets fed up into the aorta. And then once it's in place, you inflate the balloon just like this. And it stops the blood flow. And it gives you time to help a patient to get to the operating room or what have you. And that's for the bleeding application. Mm-hmm.
It seems so simple when you demonstrate it that way, but you know that there's like years of research that went behind it. It is fascinating. Thank you for bringing that. I want to explain something else to viewers. Reboa devices are measured in units called French. So at first, the average Reboa was about 12 French. Through recent models, around 7. That device that you showed us, the Cobra OS, is also an acronym, is 4 French. So tell us about the benefits it creates by making it that small. You've already explained that there's less damage.
Yeah, so because it's that small, it's simple because you put in, it's almost like an IV into the artery. And so now you have access to the artery. And then you actually just feed the device up into the aorta. There are little markings here about where to go. And this is the marking that you feed it up to. And then you just inflate the balloon. It seems, we simplified it a lot, but the decision-making of when to do this for patients and who to help is very complicated, but we wanted to simplify the actual act of doing the procedure.
So exciting.
Yeah.
In addition to its application for hemorrhages that you've explained to us, the device also has the potential to improve outcomes for cardiac arrest patients, which are currently being studied. So how would that work?
Yeah, that's actually really exciting. I mean, we've seen our device help bleeding patients in hospitals around Canada and the U.S. And that's for trauma, that's for postpartum hemorrhage, that's for different types of bleeding. But the same idea used in the same way is if somebody has a cardiac arrest outside of the hospital and their heart stops, and you start to do CPR on them and pushing on their chest, trying to get their heart started, and you're pushing blood to the whole body. Now, if you put our device in, what that does is it occludes the aorta and the thoracic aorta, and instead of you pushing blood to the whole body, it actually just pushes it to the brain and the heart. And so the chance of getting someone back alive increases several-fold.
Wow.
This has been proven in animal studies, and now there are small trials going on in the world and a couple using our device that are actually using this for patients. And, I just heard about a patient the other day using our device. After 30 minutes of CPR in the community, came into the hospital, put our device in, and with 1 minute, the patient, came back to life.
Wow.
So those are pretty exciting results. It's still being studied and investigated, but, this is the cutting edge of sudden cardiac arrest care.
Incredible story. I mean, I feel like I was just on Discovery. Dr. Power, bringing power to the medical industry. Thank you so much.
My pleasure. Thanks for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.